Well, thank you and good morning. And thank all of you for being here. I know it's a busy day, a busy schedule, and we want to make sure everybody gets something out of this. And so we are here today to talk about Mississippi's future, and not its past, and really not about even its present. And that is why I hope we can keep an open mind and also an open heart to put aside the challenges that face all of us today in charting our way through the current public policy related to health care. And, you know, that's what my mom would tell us to do. Unfortunately, she sadly passed away last spring at the untimely age of 71. But she never let the challenges get in the way of her thinking for the future. She was always thinking about her children and her grandchildren. And back when my children were smaller, my mother would plan all these educational trips, and she would call them adventures. And one of our trips happened to be to Houston, Texas. And we would go to all these museums and places of learning and culture, and she marveled at what could be. So she started thinking about this big idea. She started networking with other women from the Junior League of Jackson and other women around the state, and they developed and pursued a dream for a children's museum right here in Jackson. She and her friends started to work, and they worked, and they worked, only for about 15 years. But they never lost sight of the vision and never gave up on their quest. There were many challenges and hurdles along the way, but they never gave up. My mother fortunately lived to see her dream become a reality with the opening of this beautiful Mississippi Children's Museum. And that's what I want us to think about, realities. Today we talk about new opportunities for healthcare economic development in Mississippi. It may seem like we're all dreaming, but with the right plans and the right resources and the right people, we can make this work a reality. The dreams of today will become the realities of tomorrow, and we all can truly make a difference. I also want to talk about my mother's health. Unfortunately, she developed breast cancer, but her physicians here were very great, and they were able to collaborate with the physicians at MD Anderson, also in Texas. We often traveled to Houston for a lot of her cancer care and talked about how nice it would be if more medical opportunities were available right here in Jackson. In just the last couple of years, this also has become a reality. So my charge to you is simple. Let's think big. Put the challenges facing all of us in healthcare today aside, and let's focus on the opportunities of tomorrow. Let's do some dreaming, and at the end of the day, let's make a real commitment to rolling up our sleeves and starting the hard work to turn these dreams into a reality. My children like Walt Disney, and he was a great Imagineer. And he thought about his movie character, Cinderella, as she sang the dream, saying, "A dream is a wish that your heart makes." But Walt Disney was also a businessman who knew what it took to make dreaming a progress in reality, which is why he also said, all your dreams can come true if you have the courage to pursue them. So again, let's dream big, and let's also plan wisely, and let's have the courage to move forward. Today, our convener is the Governor Phil Bryant, a leader with great dreams and a leader of great courage. He joins us today in what is the first official activity of the Mississippi Healthcare Solutions Institute, an organization he created to be the forum of carrying out the work of boosting healthcare as an economic driver in Mississippi. And fortunately, I'm honored to be the first year. Thank you very much, Governor. I first learned of Governor Bryant's passion for healthcare economic development in my work as the chair of the Greater Jackson Chamber Partnership. Governor Bryant helped us organize a trip to Houston to see the healthcare corridor that they had and learn how we can make some of those same things occur right here in Mississippi. We came back and helped the Greater Chamber Partnership and focus our plans for a healthcare corridor. Further, he asked MEC to help launch a major statewide study on healthcare as an economic development driver, a summary of which is in your chairs. And after taking office, one of his first legislative initiatives was pushing for the creation of a healthcare zone around the state to prime the pump. Thanks to the governor's leadership and support from the legislature, as you will hear today, the healthcare zone legislation is already making a difference. These are just some of the examples of the governor's vision and hard work. He is focused on the future, committed to our state's success, and dedicated to the cause of making Mississippi stronger and more competitive. So please join me in welcoming our host today, the Governor of the great state of Mississippi, the Honorable Phil Bryant.
Thanks for doing this. Thank you, Dr. Hayes. Thank you and good morning. when I have an idea, usually part of it is borrowed from someone, and some I try to add to myself. That's all right. A good idea is worth passing around. I first found out about the Houston Medical Center in about the 1970s when my dad had a heart attack. Now, he worked for the Jackson Mack Company. He was a diesel mechanic, and how, I'm not really sure, but his boss at that time and the insurance company that provided coverage for those working men and women decided that if he didn't have an open heart surgery, that he would not survive. My dad was 43 years old. So they decided they were going to move him to this place in Houston, Texas, and a couple of doctors out there, Dr. DeBecky and Dr. Cooley, starting this new radical program that where they could go inside your heart and take veins out of your legs and transport them and put it back all together. Well, it sounded pretty challenging to all of us, and poor little kids that we were, that our dad would be so far away in this new dramatic procedure. My dad lived to be 73. Now, that was some of the very first opportunities that we had had, and almost anyone had heard of that radical procedure called open heart. And his life was extended because of Dr. Jimmy Hayes, Dr. Clay Hayes' father, who continued to provide the world's best health care for my dad until his final days. And so I have a personal stake in seeing others have the opportunity to explore some of the great healthcare innovations across the world. And so as I became governor, I remembered Houston, Texas. I began to read about economic development and how hospitals and physicians and nurses and pharmacists and the healthcare management institutes were all helping drive the economy in so many of these states, what was going on in Orlando, and what was going on in Nashville and San Diego and Houston, Texas. And so I got a hold of some Dwayne O'Neill, and I said, we need to go to Houston. He said, absolutely, we'll line some folks up, we'll take off. And there we were with Dr. Wardetti and visiting his staff and seeing that remarkable medical city. And indeed, it is a city. And I thought of Jackson, and I said, as the hospitals we have here, we can do that. It may not be on that level, but we can certainly have a medical corridor here. And we began to explore that idea. Then we looked at the rest of the state and said, why just keep it in Jackson? Why not let everyone have medical zones? Why not use this great thing we call health care that God has given us through our wonderful physicians and healthcare providers, and extend it to a growing economy? Healthcare is an economic driver. So, of course, we had to call Blake Wilson. You can't do anything in this state without MEC. I've just found out if you're going to get anything done, call Blake Wilson and Sandy Maxwell, and they will get it done. And the event that you see here today, the invitations, much of the materials that you have in your chairs and that you'll hear from today, the speakers, all of the details that go into having a summit with 800 people are because of MEC. And I'd like for you to take a moment and thank them. Blake, I don't know where you're at. Sandy, but thank you so much. Great job. Now, you're going to hear some great speakers today. Bob Hess is going to tell you about the study, the Blueprint Mississippi study that was put together that I asked, again, MEC to do when Haley Forsackerly was chairman there. And Haley stepped up immediately and said, we'll begin to do the research for you, so we'll have some type of roadmap. You're going to hear from Dr. Wardetti, from the President Emeritus of Texas Medical Center, where he's been since 1984. We will show you the roadmap into the future. We will hear from Dr. Hannah Gay, as y'all all know, has done something remarkable of helping cure a child of HIV/AIDS, and the world has taken notice. We here in Mississippi have phenomenal opportunities in health care. Now, we have wide differences and debates, and I understand that, because you see, each industry that I work with, whether it's energy or the automobile or aerospace, the same differences occur there. Each one of them have different ideas. They argue about where plants should be, and should we have electricity in automobiles, or should we move forward with compressed gas? Oh no, they say, leave this combustion engine alone, because the price of oil will go down and our drilling won't be as proficient. You see, all those challenges go on in every business, so don't think you're alone. Now, you do have some great challenges. you have doctors. I love physicians, don't you? I mean, I love them, but they're physicians. Come on now, guys. You know, I mean, if you've been to medical school, there's a certain characteristic that doctors have. But if you can channel that world's knowledge and energy, then marvelous things take place. Just ask Dr. Hannah Gay. So we're channeling much of the energy and the intelligence, the determination of the physicians that are here today. But this industry is so vast, from insurance to manufacturing, pharmaceuticals, to all the support systems that go on, to laundries. I just opened a laundry not long ago in Marion County that does 1 million pounds of laundry a day for hospitals. That's a pretty good-sized industry. They're employing about 100 people in Columbia, Mississippi. I'd like to have about 4 or 5 more of those. You see, those are jobs that oftentimes those folks who live in that area might not have. It is not the high-tech industry that could be in the medical corridor, for example, but to a family working there in Marion County, it's just as important. So we must come together on those things that we agree on and move forward on them. We can continue to debate those things that we disagree on, and that's fine. But let us not have perfection become the enemy of the good. I struggled with that during the legislative session. It was always one good idea that we were trying to move forward, and someone would come in and say, it won't work. It just won't work. Well, why? Because this particular chairman's opposed to it, or, you know, we killed a bill that they had last year, so they said they're going to kill this one if it comes over here just to show us they can do it. And, oh, we just don't have the money to do that. And if you know it, next time it'll be a tax increase. And there was always reasons that we couldn't do something. And we always push forward to find the ways that we could do it. Now, I think we can make Mississippi, and particularly this great metro area, a center for the healthcare industry as an economic driver. Look around the room, you'll see a lot of us folks that are called baby boomers. Now, we've driven this economy since hula hoops. Every time we want something, every time we have to have a product, it explodes, whether it's convertible automobiles or houses. Next, it's going to be health care. And if we're not prepared for that, when the 40, 50 million baby boomers in about a decade rush to the hospitals and to the doctor's offices, and they say, well, you're going to have to call us back in about 6 months. That's as quick as we can get you in. We've got to start preparing today for that eventual day where we will be there. So we'll talk more at noon about our new medical school, which I'm very, very proud of. Let's just say if we did nothing else in this administration to help build a new medical school should have been enough. I mean, I could go on as governor and say I was there when our new medical school started. The last one was in 1954 that it was built here. But that's not nearly enough. A medical corridor is what we need. You'll hear about workforce housing, that how we're working with Home Corp in Mississippi to give the highest tax credits possible for workforce housing in and around the medical communities. You'll see new hospitals that are up and moving, and how the state's doing their very best to help them in economically every way we can. You're going to hear about the medical city at Houston, Texas, and how it began and how it's flourishing. I want to thank our great United States Congressman Greg Harper for being here this morning. And Mr. Congressman, we could not do it without your help. I read this morning in the Clarion Ledger that Congressman Benny Thompson said he is supportive of our medical corridor and believes it's a great idea. As a matter of fact, I haven't met anyone that said that's a bad idea. And in my world, that's an unusual thing. There's always somebody that's been against something, and particularly ideas that I might have. But no one I run into says, you know, I think that's a terrible idea. I think expanding a medical corridor from Rankin County all the way to Hawkinsville and making that the area of energy and vitality and dynamic growth, to live, work, and play for the medical community in this area, I think that's a terrible idea. No one has said that. Why is it not happening? Why aren't we moving faster? Well, hopefully, we'll talk about some of those reasons and find some of those solutions. First off, have you ever tried to get a bunch of hospital administrators to sit down and talk to each other? Not very easy. I'm just going to tell you now, I've done that a couple of times, and the synergy in the room could probably tear the curtains at the temple. But we're going to make them sit down and start working together. They can do that. I know it's a very competitive world out there, and being a hospital administrator is about as bad as being governor. I love at times when they begin to tell me the challenges of trying to manage the hospital. You ought to try to be governor. The challenge is there. But coming together with those things that we believe that we can do, moving forward, showing the rest of the world. We've had great successes here in Mississippi. The American Legislative Exchange just rated Mississippi as the top 10 in the top 10 for economic development opportunities. Now, if you noticed, just recently we surpassed $100 billion in our GDP in Mississippi. That's right, a billion with a B. You'll see some numbers that will come out for unemployment here about the 19th of this month that will indicate we're trending in the right direction. Whether it's Nissan's new supplier part or Yokohama Tire Company, great successes are occurring every day. Just yesterday I was out with a company and filled up the very first automobile from the very first distribution center of compressed natural gas in the state of Mississippi. There will be hundreds across this state before long. Will have a dramatic effect on business and individual cost of living and quality of life. I won't go on any longer. I will tell you, if you have an opportunity to take a look at this particular folder in your chair, it helps explain to you a little bit about what we're doing in the healthcare zones, how the state of Mississippi is trying to encourage private sector investment. Now, I'm going to shock you by telling you today is not all about what the government can do for us. Because if we keep standing by and thinking the government is going to solve all our problems, then we truly will fail. I am of the opinion that the more that we get the government out of health care, the better off we would be. I know that's shocking to you. Everyone calm down for just a moment, but think about that. Now, if we just got to the position again to where we had faith-based organizations like the Catholics and like the Baptists and like the Methodists helping us deliver our health care, which they do now. If we were looking to the private market again as a driver for health care in this country, if we didn't have the federal government, we weren't so dependent upon the federal government to be able to open the doors of every hospital every day, it seems as if there was a time when we could make it under that model, and now we can't. We believe we can't. We're going to work hard. We're going to come together for all faiths and denominations, geographical locations, nationwide, statewide, worldwide if we have to. But I can assure you the challenges of health care that we face here in Mississippi are great. We lead in many of the categories you don't want to be at the top of the page. Whether it's obesity, heart disease, diabetes, we seem to be the leader in those categories. So we're going to work hard to make sure that we have access to health care here in the state of Mississippi and that jobs are being provided in that industry to help grow this state. Thank you so much for being a part of this today. I believe it will be a great benefit to you. I know it will be a benefit to the state of Mississippi. Thank you.